Hey, thank you guys so much for being here. I do appreciate you guys being here this morning. We're here at Tuckahoe again.
As coronavirus cases continue to rise here in the Commonwealth, one of the biggest conclusions the Virginia Department of Health can draw from their data is who COVID-19 is disproportionately affecting the most. The answer is the Black and Latino population. That's why the Richmond City Health District held several free community testing events in August, including here at Tuckahoe Middle School.
In Henrico, about 70% of our cases are either African American or Hispanic. 40% in the African American community, which is disproportionate because the baseline rate in Henrico is about 30% African American. And then about 30% of the cases are in the Hispanic community, as compared to a baseline rate of 5% of the total Henrico County residents are Latino.
Much of the COVID-19 response effort comes from the Medical Reserve Corps, who are mostly volunteer community members or health professionals who are responsible for setting up and making sure a testing operation goes smoothly. For Shatara Jackson, the work MRC does gives the community a vital option to a group that needs it the most.
I think this is extremely important, being able to reach people at the community levels, because not everybody can get to a patient first or get to a hospital to get checked. And I think bringing the service to them does help out.
I work part-time in a building that certain people had it, and I just want to make sure I'm safe.
There have been about 50 testing events held in Richmond and Henrico, but over time, nurse practitioner Tracy Avery Jeter says she's noticed not as many people are showing up to these events based on a couple of reasons: fear and trust.
If they feel like that there's some reason why they shouldn't trust, then that's where there'd be a problem. But if there's a trust that's there because our community health workers are there, the community leaders are in place, then I think that people understand the importance of it and they come out.
Some of the fear is associated with the question, is the test painful? Avery Jeter says it shouldn't be. A swab is placed in each nostril for a few seconds and the test is complete. The hardest part for individuals might be waiting the typical 2 to 3 days for the results.
It's a weird sensation, you know. My eyes inside is a crazy thing, but it's okay, man.
Yes, it's important that everybody knows how they stand, what their status is, so they take care of themselves and others.
Now, the testing is free for those who are primarily uninsured or underinsured. And for more information on registering, testing site locations, or eligibility questions, just visit the Virginia Department of Health's webpage. It is